Good afternoon, everybody, and welcome. Isn't it so lovely to be in a room with lots of people? It is just much more energizing. You just realize how much we've missed out on over the last couple of years. Just the idea of being able to connect with people, talk to people, have a cup of tea with people and share thoughts and ideas. And so it's an absolute joy to welcome you all here today for the Mind and Body 4th birthday for our Champions Programme. I was expecting a little reaction there. Kind of, ooh, yes. Okay. 4th birthday, which is amazing. And for the launch of our Quality Improvement Network as well, more of which later. Everybody in this room is interested, as Jill said, in how we try and shift and change our system to do something about the appalling and abysmal stats that we all know that are out there. So we have this, as everybody knows, we have this dreadful situation where for those of us who have a diagnosis of schizophrenia, people will die somewhere between 15 and 20 years earlier than if they don't have schizophrenia, with schizophrenia as a pathology not actually killing anybody. And of course, people develop all sorts of long-term conditions and all sorts of health problems secondary to all the other stuff that comes associated with it. Smoking rates that are at 70% rather than down at 10 to 15% in the rest of the population because people give up on helping people not to smoke. Rates of use of gyms and exercise and healthy eating and all the rest of it that simply is not adhered to and engaged with in the way that lots of us try and do for ourselves and our families. And then of course the other big reason is that when people do engage with healthcare, they have to navigate all this dreadful interface problem. And so you end up with people having mental health problems on the wrong side of the road, if you like. Taking our example of Denmark Hill out there, which is a brilliant example of a sort of concrete interface between Kings on one side of the road and the Maudsley on the other. And I work in liaison psychiatry, and I say that when on my more kind of my more down days, I end up saying that what I think I do basically is just help people cross the road a little bit more safely. Because what we're talking about is being able to access care in the right place with the right experts who can actually do something to help people with the conditions that they have. And so that very much is at the core of what we're trying to do in the Mind and Body Programme. And we are so fortunate in our local network in King's Health Partners to have both investment from Guy's, Tommy's, King's College Hospital, SLAM, and our partner at KCL to help us set up this group called the Mind and Body Programme, which has been going for sort of several years now. And the Champions Network, as you heard, is now at birthday number 4. But what we're trying to do is work out how we engage in making our services and systems work better. But the idea of the Quality Improvement Network is that what we want to do, the challenge that we're trying to address is okay, we're sort of several steps on a journey to trying to make this work a little bit better in South East London, but how do we sort of burst out a little bit? How do we try and spread best practice across the rest of South East London in our new ICS, our new integrated care system? And how do we also try and take all the amazing knowledge, skills, expertise working in this area out further afield than South East London?